All right, we'll call this special meeting to order. City Clerk, if you'd call the roll, please.
Mayor On,
Here.
Vice Mayor Colodi,
Here.
Commissioner Sacks,
Here.
Commissioner McGirt,
Here.
Commissioner Hartman.
Here.
Thank you.
All right, we're going to hear from our fire chief, but first item up is public participation. You'll have 3 minutes to address the commission. We do ask you keep it on the topic of the day. We've had, feels like 100 public meetings this month, so we've had plenty of time to talk about everything else. Let's stick to the topic today. Any members of the public wish to address the commission? Now's your chance. Seeing none. All right, Chief, go ahead.
Good afternoon. Sean Van Fire Chief. Real quick, we're going to run through some data that you've already seen probably. I just want to really touch real quick on it and get it knocked out. I have a presentation that should be popping up on your screen there. Locally, we have, just so y'all know, we have 2 firefighters, one who is confirmed COVID positive, one who is highly suspect. The test hasn't come back positive, but we highly suspect that the second person is going to be ill also. In addition to that, I have 5 members who are on, 5 additional members who are in quarantine at their house for the next 14 days. So 7 people out of my 49-person workforce is out right now. Police department has 2 officers who are on cautionary watch. Basically, they're at work, but they're having to mask up and social distance, as well as 1 administrator from the police department. Real quick, Volusia County at a glance. This was presented to County Council yesterday, so same data that we presented or we witnessed yesterday. One thing of note, in the last week, in the last 7 days, we've had an increase of 800 positive cases in Volusia County. So 800 people in 7 days, and total out of your 2,105, only 226 of them are from long-term care facilities. So the impression that the nursing homes and long-term care facilities are part of these the high numbers is not exactly true, because as you can see here, only 226 of them are from those nursing homes. New Smyrna in the upper right-hand corner, little sidebar there. From day 1 till a week ago, we had 46 homes in New Smyrna Beach local that were under Department of Health observation. We now, in the past week, have added another almost 40. So we almost doubled in 1 week in New Smyrna for households that are under watch by the Department of Health.
Chief, quick question on this. We always see cumulative numbers, and I've been asked before, and I couldn't quite put my finger on it. I mean, we obviously report deaths, but is there like an active column where there's like, okay, we've had this many cases, but there's kind of this many that are actively being monitored, and that are still out there potentially spreading this, and what does that number look like over time? Is that growing, shrinking?
So we do have a growth in that. Obviously, if you in a slide or two, you'll see we have new cases that have popped up. So if you're looking at a 2-week window of illness, so obviously if we had 200 cases 2 weeks ago, those have fallen off of the cumulative, obviously. So we need to look at trends. We need to look at how much growth we're getting. And we also need to look at positivity. Positivity being significant, because positivity, if positivity is high, then that's not an indication of we're seeing more positives because we're doing more testing. It shows that the ratio between infected people and the tests that we're administering that's probably a more valid number, positivity, than is the total number of positive cases or total number of cases out there, because you have to, obviously we're doing more testing than we ever have done. You're going to see a climb, but when you have 1,000 tests administered and you have 100 of them that come back positive, that's a 10% positivity, which is pretty significant. So that's definitely something to pay attention to, not so much how many tests we administered, how many are coming back positive. Another important fact is that when you look at the 2,100 cases in Volusia County, that's 2,100 cases that have tested. That doesn't mean that that's our total number in Volusia County. That's just people who have submitted to a test at somewhere. There's no way to put a value on what is out there right now who haven't had a test administered to them, because we haven't reached them all.
Mr. Mayor, question for Chief.
Sure.
Chief, do those numbers include antibody tested?
It does. can't speak to that, to be frank, because antibody testing is you're looking back in time with antibody testing, whereas the one they're doing next week at Volusia County Fairgrounds, for example, is a PCR test, active virus test. So, so when you're talking about 2,100 cases, you're talking about those are ones that the Department of Health have deemed a credible contagious patient.
Yes.
Does that make sense?
Yes. Thanks.
Chief, is there any data on the ratio of positive tests of those who have been tested and those they suspect are out there? Is there any data? Has anyone crunched any numbers to tell us what the true infection rate in the community may be?
Nobody's nailed that down for a couple of reasons. One, you don't know how many people we've touched with satellite pop-up testing. We don't know how many people we've touched. We have a number, but that's not a real sampling of anything other than people who happen to be available on a Tuesday, Wednesday, Thursday who could go by and get a test. When last week or 2 weeks ago at Chisholm Elementary we tested 1,100 people, that's not a sampling of New Smyrna. That's a sampling of the 1,100 people who were available to go by between the hours of 8 o'clock and 1 o'clock to go get a test. So,
well, I understand that, and I guess I understand that. What concerns me is, previous to the past week or two, it was more of an issue of no one really knew personally people who were getting affected. And I can tell you that in the past week or two has been a tremendous difference. You have businesses all through the community who have had to shut their doors due to it. We now have people within our city staff who are now testing positive. So this seems to be growing exponentially very quickly. So the low rate we're getting due to the testing, at least I suggest that it seems very low based on what's happening in the community, which we didn't have previously. Now we have, and so I get my question is there any data out there saying what percentage that we believe is positive in the community?
None that I've seen. You're looking for a forecast, or not so much a forecast, but a
Yes,
perspective
some kind of
what we sampled 5% of all the population, but the real number is
some kind of statistical analysis that says that this is where we truly believe that this is within a range.
right.
But I understand that we're not getting a true sample because the people coming in is not providing that kind of cross section that we need to create that.
Correct. The only way to get a good cross section would be to grab people off the sidewalk and force them to be tested, and obviously that's never going to happen in America. So that's how you get a good random sampling of the people of New Smyrna, is to mandate testing of a random number of people.
Thank you, Chief.
Commissioner McGurk, this morning we had a conference call with the managers, and we had the director of the health department give us an update. Just the past 2 weeks, the positivity rates went up from 5 to 8.7%.
From 5% to 8%.
8.7.
Almost 9.
And positivity.
Okay, so it almost doubles, but what I see in the community from when we first started this, no one seems to know any cases, and now we're seeing a lot of cases all over the place. In other words, it's much more tangible to people. So that's why I'm wondering if there's someone or somehow we can get data on what that positivity rate reflects in the community a little better than just what we're dealing with now. Thank you.
On your screen, you'll see the census of the local hospitals throughout Volusia County. 26% bed availability right now. According to Dr. Springer, that's the norm for this time. So the hospitals are not being inundated yet. The 75% census is about normal for them anyhow. If you look at the demographics, if you compare the left and the right bar graph there, they are almost in step with each other. And what you're looking at is you're looking at the total population of Volusia County and the spread of coronavirus on the left-hand bar graph. So left-hand bar graph shows the confirmed cases. It's almost in perfect lockstep with the total overall population. So there's nothing. So when we were discussing elderly patients before being the primary carriers of this, it's not really quite the case anymore. The median age right now in Volusia County is 43 years of age. That's our median COVID-19 patient. So it was up in the 50s and almost 60-year-old. Now it's dropped significantly. So it's definitely out. When you describe hotel or businesses and restaurants being impacted, this is where you start to see those numbers. When your median age comes down, that means that people are getting out there socializing, doing whatever bad behaviors they do, and that causes that median age to come down. And then just to draw parallels, the graph isn't really significant other than that you notice that Volusia County and Florida are again in lockstep with each other. We're not exceeding Florida's numbers. We're not doing better than the rest of Florida. So if you compare the two, they're pretty typical. And in addition, I want to let you all know real quick that next week, Monday, Tuesday, Thursday, Friday, they're doing PCR testing, live antibody testing at Volusia County Fairgrounds between 8 and 4. That's a free test. You just drive up. You don't even get out of the car, I don't believe. And there's no charge for that. They don't even collect insurance information when you show up for that test. And I'm here for any questions.
Okay. Any questions of Chief? Other questions of Chief? All right. If not, we have a resolution in front of us. Carrie, remind me, does this require the supermajority or just a standard majority vote?
Standard majority vote.
Okay. All right, so we have a resolution in front of us, as was discussed last night. Carrie got the language that I think we had agreed to last night. So this is for commission discussion. I was trying to call out. So section 5 the old section 5 has been removed, and then in like on line 106, you see beach is encouraged to wear. So just calling out the changes that were made from last night's version of this. With that, do we have
Motion to approve resolution.
Second.
23-20? Okay, we have a motion to
Motion.
approve resolution 2320 in a second.
I'd like
Any
discussion because I'd like to bring forward a motion to reconsider the previous motion.
Well, that motion hasn't even passed yet, so I don't think we can reconsider it, but you can certainly, let's discuss it, and if we can get some amendments to it, you can maybe go for that.
All right, since we have a motion and a second,
But it's open for discussion, so,
I think our request from last night should be more of a requirement. That's pretty straightforward. I hope if we do approve that, it would not change language much, but it would add some strength to the resolution, considering the report from the chief, considering what I've been following in the media. I'd like to be 2 steps ahead of this instead of 10 steps behind, and I think we're already behind the 8 ball. And we're just approaching July 4th, which is going to be very busy with a lot of people non-complying.
okay.
So I would support Commissioner Sachs because I think that the asymptomatic people that are out there, we have no idea who they are or where they are, and I think those numbers are growing. So I don't think this goes far enough. So I would encourage you guys to put it back to the original language where it's mandated.
And when you say original language, just for clarity, I'll come back to you in a minute. We had that section 5 that included some enforcement provision and a penalty. Are you proposing that in the original language as well?
Yes.
Okay. Do you have a comment?
Yes.
I'll come back to you.
Seeing the support has changed from last night, I'm certainly willing to rescind my motion. I will at this time rescind my motion.
Okay. Vice Mayor, you had a comment?
If we put the enforcement provision back in, who will do the enforcing? I mean, there's nothing in there to say how that would be carried out.
I look at it as another tool in the toolbox of the police department. I don't see them going out actively looking for people that are not wearing masks, but if the occasion arises and something happens,
Come up.
Right.
You'd have to make it in way of an ordinance for us to enforce it.
Yeah, that brings back the question of why we're here today and not last night. Is city attorney had time to draw up this resolution, and city attorney, how would you want to proceed if now we're going to go back to the original idea of some sort of ordinance with enforcement?
I still have the draft from last night. If you guys would discuss an effective date, and if it appeared that there's a supermajority in support of it, I can print them. We can take a 5-minute break. I can put in the effective date, print them up, and distribute them, read it. But it will require a supermajority to adopt an emergency ordinance.
Okay, so I've rescinded my motion on the resolution. I do want to discuss the reality of this is not an absolute if we pass this. We cannot expect the police to start playing, we can't expect them to just start handing out fines. And what was discussed last night was, or at least my belief is, a non-criminal offense but a civil fine for people who are not wearing masks. Now, the problem this is going to create is the police department can very easily be overwhelmed. And the expectation that we, the commission, and the residents would have on them, we need to make sure that that's not unrealistic. And what I think is unrealistic is that the cops are going to be proactive on this. How Commissioner Hartman suggested maybe it gives the police department some tools in the toolbox if they see a specific situation that they come upon, and this tool allows them to break up or control what they're seeing is a problem. I think that's good. But I do not believe the expectation of the police department being proactive on this ordinance is realistic.
Once again, I do have a problem with the enforcement. I don't want to put us in the position where we're asking our police to selectively enforce who should wear a mask or not. I think we're just going down the wrong road on that.
Yeah, I'll chime in here as well. I tend to agree with the vice mayor. I'm afraid, I mean, because we have, even in this, and it was in the other one as well, we've got the exceptions. So a face covering that causes impairment due to an existing health condition. So you got an officer that got called to a scene because there's 5 people not wearing a mask and someone's frustrated by that. Now they're evaluating health conditions to figure out if they're, or do we punt that to some judge because they're going to contest this ticket, and now some judge, they have to validate you get HIPAA stuff. I mean, I don't see how we do enforcement. I'm comfortable where this is at. I'm comfortable with what it was. I think we're sending a message. I made this comment last night. You got folks on both ends of this, and there's folks that are going to wear a mask no matter what we say. There's folks that are not going to wear a mask no matter what we say. We're really angling for this small percentage in the middle that we can try to raise awareness for. And frankly, I put myself in that vantage point. I mean, you've watched me evolve a bit over this. I'm wearing a mask today. I wasn't a few weeks ago. Like, you're angling for some folks in the middle. You're not going to reach these extremes. I don't care what the penalties or fines are, but we are going to put ourselves, I feel like, in some risk. So I couldn't support anything that really is above and beyond what we have here right now. So that's just my stance. So if we go to something that requires some supermajority, just
Yeah,
keep that in
so
account.
obviously right now I don't see a supermajority. So unless something changes, I'll make a motion again on the resolution, but but I don't see, there's clearly not a special supermajority here.
Let me just give you this path. Was that a motion, by the way, or were you just saying you could make another motion? You haven't made one
was
yet,
not
right?
a motion.
Okay, got it. So, I mean, we could correct me if I'm wrong, we could, if it was the will of the commission, change the language in this resolution to say mandate versus suggest, or whatever language we use here. Encourage, yeah. we could change that language just in this resolution, but unless we had we don't need it to be an ordinance and do the supermajority unless we have that enforcement provision and we're trying to attach a fine to it. Is that a correct statement?
The enforcement, yeah, if you're going to have an enforcement provision, it needs to have the force and effect of law, which is what
The
you use an
ordinance.
ordinance for.
Yeah. So the middle ground on the mandate would be sticking it as a resolution. You don't need the supermajority at that point, just to give the commission that option.
I think that's better than encourage, and I can certainly support that.
So one thing I do want to point out is the change from the emergency ordinance last night to the voluntary resolution. If you have the emergency ordinance in front of you, the exceptions, since this was voluntary, the exceptions shrunk on the resolution. So if you're looking to change your voluntary resolution into a resolution mandating it but without enforcement, I would want to add back in the full exceptions that were contained within the ordinance.
Can you give us a sampling of?
Sure.
I don't think most of us.
So
have
the
one from last
ordinance, the emergency ordinance had exceptions for the ones that were deleted. Persons observing social distancing in accordance with CDC guidelines would come back in. Persons working in a business or profession who do not have interactions with other persons would come back in. Persons working in a business or profession who maintain social distancing from another person would come back in. Persons exercising while maintaining social distancing would come back in. Persons eating or drinking would come back in as an exception. And those are the only ones that were removed.
Okay. So recommendation to the city attorney is if we change that language to mandate that we include those items back in. And Carrie, last question, if it is again the will of the commission, this is the direction they go, would you want to take a break, redraft that, print that out for us and have that in front of us, or are you comfortable with us just giving you that direction and then I'd stick around and sign it here in a few minutes if it passes?
Take a couple minutes.
Okay.
I can do it pretty quickly.
All right, let's see what the will of the commission is. So got a couple different options. We can pass what's in front of us. We can go the emergency ordinance route requiring a supermajority. I don't hear the support up here. Or we can do the mandate within the resolution. Or we can do nothing.
Well, my preference is to approve what we have in front of us now.
Okay.
You know, and I don't want people to think I don't believe this is a serious condition, because it really is. Social distancing is very important. I practice it. I'm one of these people that's highly susceptible to it. But I don't think that we have to, and I won't call it a draconian measure, but put a measure in there that is in all likelihood going to be ignored. I think we should take a reasonable approach and just support what the governor said, what the county is doing, and leave it at that.
Okay. All right. I too was very comfortable where we were last night for all the reasons stated earlier. Certainly wouldn't support anything that had any kind of penalty in it. I don't know that I would support a mandate either for some of the reasons Vice Mayor just stated. But that's just my stance. I think, and many of the same things apply. It's not that I don't believe in it. It's you know I don't want to have a debate about the science of masks because I don't know. I'm not a scientist or a health professional or anything else. I know that if it helps, great. If it doesn't, it's not. You know what harm has it done for me to wear a mask? So you know, for all those reasons, I support as many folks doing it as possible. I think we should all be in this together. But I'm just not a fan of the mandate. I don't think it solves anything. But I heard three others that were. So do I have a motion?
I would bring forward that same reconsideration motion to mandate. As far as the police department goes, we know they're overtaxed already. I would not want to overburden them by asking them to write tickets for every infraction they see. But if we have flagrant violations or incidents that warrant in their line of work by priority, if they have time and need to investigate a certain issue of noncompliance, then I would ask them to. I don't think an ask at this point is strong enough. I don't know how better to say it. The federal government has already said you should be wearing a mask to protect others first and to protect yourself. And, we have all those people that work in our city, that work with the public, especially first responders, and all the way to a person in a restaurant. We're not doing our best to protect them if we just ask them. I would love for us to just do a request like we did with plastic straws. It worked nicely. But in this case, like with seatbelts, people hated it at first. People eventually complied and wore seatbelts. And we're certainly not asking for anything that draconian. Hopefully this will be short term. So, again, I don't want to tax the police department, but they would also know that they could be out there, and if they see infractions, they could kindly tell people, we have a mandate, wear a mask. I'm not looking for them to fine everybody, and, monetary punitive fines are a burden as well. But we have to set the example.
Okay. So I heard the word motion in there, but I need succinct clarity on
Well,
what
motion
exactly.
to mandate the wearing of masks.
Second for discussion.
Okay.
I need clarification from the motion maker on whether or not you keep referring to the police for something. I think the middle ground was we're changing the language instead of encourage to mandate with no enforcement. Now that's simply, it's hollow, but I'm not against it because I want the people out there to know that their leadership very strongly wants them to wear masks. So is your motion just to change the language and not include enforcement? Or are you including enforcement on that?
It would have to include some type of enforcement, yes.
Yeah, I can't support that. I can support the stronger language, but I can't put the police in a situation where we're creating essentially an ordinance that they need to enforce, but it's impossible. There's no simple solution here because creating a mandate that doesn't have enforcement is going to be very confusing to people. However, I'm willing to do that under these unique circumstances because we need to stress the importance of wearing masks. So I seconded that motion, but I will not support enforcement.
Okay.
We're all in
Speaking of the
agreement.
mic so they can hear you too.
We're all in agreement that we need to do something. Do you think, though, that mandate without enforcement is as I don't want to say useless, is on the same level as request? Meaning, right,
Not sure I follow.
mandate without enforcement is just saying, we're requesting you to do it. Because nobody's going to say, you must not.
No, that's accurate. You're
Right.
absolutely accurate.
Right.
I'm simply just willing to use a stronger piece of language to try to stress the importance that we feel that the community leaders feel, which is now being, you got the federal government, you finally have people getting on board with trying to stress face masks. And all I'd be willing to do is stress that with the strongest language I can without an enforcement measure because I think the enforcement measure is completely impossible.
Here, yes, I agree.
So I can support the mandate word, but not if there's enforcement in there.
Okay. So I think as a matter of practicality, what Commissioner McGurk is recognizing is, I think even just in this body, that mandate would require us taking a step which would require an ordinance, which would require a supermajority, and I don't think you've got that supermajority is frankly where I think we're at. So I think the middle ground is adding the word mandate to this resolution, leaving the ordinance leaving the enforcement provision out. I think that's, or accepting this as is, or doing nothing. I think that's what I'm hearing support, at least 3 support for up here right now. So but had a motion on the table. I think the clarity in your motion was that it included adding back in that enforcement. So we can either, we can vote that, or we can try to amend that to get something that you think might pass. So what's the motion maker's pleasure?
I'm trying to bring agreement so we can find something that will pass that may work. So I would make the motion to change the wording to mandate and exclude enforcement.
Okay, so it's to adopt resolution 2320 as presented, except changing the word and request or encourage. Sorry, I cannot get that word right. Encourage to mandate. And then is the motion maker acceptable to accept city attorney's recommendation of adding back in those provisions, the exceptions that were excluded
Yeah.
in the previous one? Okay, is that acceptable to the seconder? So we had a motion and a second. Carrie, I feel like there's broad support for that, so it's probably worthwhile. Do you want to, you probably already got it done. Probably just need to click
Yeah.
print, is my guess. So 2 steps ahead of us down there.
Gentlemen, can we be agreement that if police force has time, if they see somebody without a mask, that they can gently remind them that we have an ordinance? I'm sorry, a mandate.
Yeah, I mean, I think if they have opportunity and it's the perfect scenario for them to do so, and they don't feel like that will escalate some situation, then I think they can absolutely, remind someone and encourage it. I think, I think Commissioner McGurk spoke to this. The bigger thing is, I think, just seeing it, there's a lot of psychology behind when you feel like you're in the minority and not doing something. That's the pressure that forces people to comply more than almost anything else. More than anything we do up here at this dais, it's seeing, out of a crowd of 10, I'm the one that doesn't have one on. Now all of a sudden there's that positive peer pressure to do it. So that's what's going to really tip this tide more than anything else that any government body does, is just the general public buying into this. And so, but yeah, certainly if our officers want to help lead by example and remind folks in a very courteous, nice way that we do have this mandate, raising that awareness, I think that'd be fine.
Deputy Chief, you think it's possible?
Okay. No pressure, Carrie, but we're
Yep,
I'm looking at you.
Gotcha.
Anything, there's a section for commission comments, so while she does that, this is our chance, because as soon as we get that done, we're gonna close out. So any other commission comments or things to bring to the commission today? I will share an update. We had talked last night about reaching out to the county related to beach closures. I did send that email this morning asking them to consider it. And I'll have Khaled forward the reply I received to you all from the chairman. But basically the stance is that the vehicles being spaced out and there's good compliance for social distancing. So I think that's the county stance, which I think we anticipated. But so any other commission comments while we're waiting on Carrie? Anybody got a song or something they want to do for us?
Claire does.
Claire, you want to do some karaoke down there? What?
Khaled, do you have enough PPE that we can provide for all employees that want them?
Thousands.
And we
plenty
encourage
of
them to
PPE.
use them?
Yes.
Okay.
Well, thank you for the update, Mayor, on the county's position. We did expect that. That's another difficult issue to try to resolve.
Yes. The only good thing, if I can say it that way, is I haven't heard of any, before when this was all kind of first coming down, we had Cocoa Beach and other beaches just south of us that were, also Orlando destinations that were closing down and pushing, the balloon, the air in the balloon, right, pushing it all up our way. I haven't heard of that. I haven't heard from the Cocoa mayor that they would be closing. So I, hopefully that.
Cocoa remained open, right?
Yeah.
Yeah.
And I think most of the beach closures I've seen are either West Coast or much further south. So hopefully we won't be getting any more than usual, although we know it will be a busy weekend. All right. Welcome to the world's most awkward city commission meeting. Well, we sit and stare at each other.
It's a good thing.
Yes, ma'am. We'll take public participation. We'll take a minute or two of public participation. Come on to the mic so people can hear you. We'll keep it formal, but we got time, so might as well hear from the public. If you give your name and address for the record.
Sandy Murphy, 4150 South Atlantic Ave. Basically, it's just a question, how long is this mandate going to be in effect? Will you have to come back and revoke it?
So it's a great question that our attorney will speak to when she gets back. Most of these emergency provisions are coterminous with either our own emergency measures that we've put in place, or with a lot of those are coterminous with like county, state, or federal provisions. So once those emergency acts expire, ours are all expiring at the same time. So it's not called out in every single one. They just all start kind of, once we cancel one, they all cascadingly cancel basically. So so there's no defined end date at this point in time to the state of emergency that we're in. I think ours is she can tell you off the top of her head. I think ours are timed with the states, and they continue to push us forward probably about 30 days at a time would be my guess, but I don't remember off the top of my head. Thank you. Good question. Any other members of the public, really quick, because I think my attorney's coming back. So.
Hey Russ, how are you?
Good. How you doing?
Good. Bo Tomlin, 2600 Atlantic. So, a couple of things. Our company is actually coming in with solutions, and love to get together with you because we have organic products that are actually destroying COVID.
Okay.
And so we're working with the sports arenas across the country to reopen them, the Jacksonville facilities, so that they can have their convention up there as well. But when you talk about the science, because that's what we do as a company, we're dealing with science. And I think we need to start to really sit down and look at the science. And I'll give you one clear piece of info for you to this committee to consider. When they talk about KN95 masks, what does that mean? If you ask the general public, they've got no idea. It means that it will filter up to 95% of the particulate matter. Great. Well, how small is that particulate matter? The answer is 1 micron. People have no idea of that. Much less how small is 1 micron. A thin strand of hair from a tall blonde Swede is 20 microns, okay? So we're talking 1/20th of a micron. Great, these masks are wonderful. How small is the virus? That would be the next question. If you go online, I think we've got a little thing called the internet, you can find out it's 0.004. It's 1,000 times smaller than the best mask in the world. So if you're in an area where somebody sneezes or coughs, it goes right through the mask. The mask does not stop the virus. But what it is doing is it's getting people, when I see people who are working in restaurants and whatnot, they look like they're going to fall over because it's changing their oxygen to CO2 level. We've already had people that have gone off the road and crashed into trees because they were wearing a mask when they're driving their car by themselves. We call that, here's your sign. That's an idiot, you know. And we have people on our beaches that are walking along the ocean out there with masks on. That's crazy. So we have to start to get back to smart humans, and let's get real here. So 1 micron versus 0.004, the masks don't do a dang thing.
Okay. Thank you. All right. City Attorney, while you were out, there was a question provided that I did my best to answer, but the timing of this, these are effective immediately, but remind me, our emergency provision is timed with the state's emergency provisions and expire. When do all of these expire, I guess is the question.
This will stay in effect until we repeal it.
Okay. So we'll just have to, once we end all of our emergency measures, we'll have to make sure to go back and repeal all of these things.
Yes.
Okay. Got it. All right, gentlemen, I know it's hot off the presses, but you have a resolution in front of us, Resolution 2320. There was a motion and a second. I just want a confirmation from the motion maker and the seconder. This is the resolution that we're voting on, just so that there's no.
And I
Yes.
could recommend one change then. We could say this resolution shall take effect immediately upon its final adoption and automatically expire upon the expiration of our local state of emergency. That would be a fix, and I don't need to reprint it. I can do that after the
Yeah.
meeting. But if you want to include that language in your motion,
Okay.
then we don't have to remember to come back.
Yeah, that thank you. So to the motion maker, and again, I know it's quick, but this is the resolution that you're passing a motion to adopt, and I would ask if you'd consider the additional language from the attorney with regards to the ending date being expiring once our other emergency provisions have expired.
The language is fine, Mr. Mayor. Thank you, Chair.
Okay, so are you okay with the additional language on the effective, the terminating at the end of the state of emergency?
Yes.
Okay, so motion maker accepts, seconder accepts. Is that a motion to accept Resolution 2320, which is the requiring or mandating of mask to be worn with numerous exceptions? City Clerk, if you would call the roll, please.
Commissioner Sacks?
Yes.
Vice Mayor Colodey?
No.
Commissioner McGurk?
Yes.
Commissioner Hartman?
Yes.
Mayor Owen?
I'm a no, I'm sorry. Not because I don't support it, but I just don't support the mandate. But I will continue to wear a mask. All right, if there's no other business for the commission, thank you all. I know some of you changed some plans to be here, so thank you all. Thanks to the public. Appreciate it. Meeting adjourned.